and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back and talking, and hope you're fine, and hope you're listening and comfortable. We had a man who came in, a very interesting man with a very interesting case from Barcelona, Spain, which is a very interesting city with this huge statue of Christopher Columbus by the port facing America. Beautiful city in the south of Spain on the Mediterranean. Anyways, a businessman in Spain, he heard about her work. He was diagnosed with a cancer of the ampulla of Vater. So what the heck is that? The ampulla of Vater is the place where all the biliary juices, all the juices from the gallbladder and the pancreas and the liver drain into the intestines. So when that became blocked, this man had jaundice. Jaundice means he turned yellow, and he turned yellow from all those juices that normally go in the intestines and give our stool, when we go to the bathroom, that's why the stool is brown. Well, if that place gets blocked, the ampulla of Vater gets blocked, and all the juices go into the blood, then the person becomes jaundiced, and they get infected because the juices can't drain, and you can die. The good news about cancers of the ampulla of Vater are that because of the jaundice is an early warning sign. So very early on, people know there's something wrong and usually seek medical attention. So he became jaundiced, yellow. He sought medical attention. He got worked up in Spain. They found the cancer of the ampulla of Vater. They put a little tube in called a stent to open up that area, and then he sought medical attention. Now, in Spain, one of his friends had the same thing, and they died in 3 months. Now, the doctors in Spain wanted to do surgery, and sometimes you end up getting what you, the specialty of the house, I guess. And so they wanted to remove the intestine, part of the gallbladder, part of the liver, part of the stomach, and pancreas. A huge operation, huge operation. He heard about us, Radiosurgery New York. He actually has friends who came to us from Spain and had great results. and he decided to put his chips on the table with Radiosurgery New York. So he came to us 10 days ago and worked him up, just like I said, staged him up. The cancer was only in the ampulla of Vater. He came and we spoke, and he wanted the treatment, and we started 10 days ago on a Wednesday, and he wasn't fine. And I said, you're not fine. And he wanted to have his treatment anyway. So I gave him the treatment, and by Friday, he looked a little bit yellow, like the stent wasn't working, like the cancer outgrew the stent. And we drew blood tests, and he wanted to be treated. I treated him, and by Saturday, his temperature was 39 degrees Celsius. Now, normal body temperature is 98.6 Fahrenheit, or 37 degrees Celsius. So he was 39 degrees, so very hot, about like 104 degrees. He was sick, he was jaundiced, and I urged him to go to the hospital. He needed that stent fixed because I think by the time it was placed a few weeks ago in Spain, it either became dislodged or the cancer grew around it. And he was having fevers, which means he was getting infected in that area, which can be devastating, even fatal. So I told him very clearly what I thought. We arranged everything for him so it'd be comfortable, and checked, and everything was said to be okay. And then Monday he walks in and he's fine. And I said, so did you do everything that we arranged for you? And he said, no, I didn't do anything. I trust in you, doctor. I said, wow, he has more trust in me than I have trust in me. And I said, you didn't do anything? And no, he trusts in the radiosurgery. Since Saturday, his temperature went away. His jaundice is getting better. Now his bilirubin, which is a measurement of that jaundice, on Friday was 6. Now his only treatment was radiosurgery. He had 2 treatments on Wednesday and Friday. By Monday, his bilirubin was down by 50%. No more fevers. Feeling fine. I asked him, do you want us to speed up the treatments? You want to go back home? You want to have the stent? You want to get ultrasound? You want to evaluate your situation? And I also offered all those things on Friday, which he declined. He said, no, I want radiosurgery. So we treated him this week on Monday, then Wednesday. We saw him Monday, Tuesday, Wednesday. I insisted that he come in so we speak. Feeling even better on Tuesday, even more better, if that's a word, on Wednesday. And then he skipped Thursday because he was feeling so good, and he had his last treatment, the 5th treatment, yesterday. So 5 treatments, each one 15 minutes for ampulla of Vater cancer. The jaundice is completely gone. He's now had no fevers for a week. He didn't replace the stent. He didn't do anything except the radiosurgery, and he is so happy. He's happy. His wife, who was so skeptical when we started, is so happy. His daughter, this beautiful girl from Barcelona, is so happy because Dad is doing so well just with radiosurgery. He's doing better than expected. We can't promise anything. We can promise to do the best we can. But just with radiosurgery, the blockage of the ampulla of Vater opened up. And think about it. Elsewhere, he was going to have surgery on his liver and gallbladder and pancreas and intestines and stomach and duodenum. And here, 5 treatments, 15 minutes, each one just aimed at the tumor. No side effects from treatment. No nausea, no vomiting, no lowering of the blood counts. No, only improvement with the jaundice gone, the fever's gone, feeling fine. He's going to all the sites in New York, showing his family the sites with a guidebook. Wow. I saw him yesterday. I said, do you want to go home early? He said, no, I want to enjoy New York City. He's going to spend another week. Now he's done being the patient. He had these 5 treatments. He's done being the patient. He's just going to see sites. He's coming in Wednesday for a check. We're doing a blood test to make sure everything is A-OK before he heads home. We'll give him paperwork so he has copies to give whoever he wants copies, mainly himself. what we did and a record of what transpired. He's done great, and we are all happy for him. We're all happy for him. In contrast, we had a woman who was scheduled to get brain radiosurgery. She had multiple brain metastases. We treated a group of brain metastases in June, and then she decided not to come back. I don't know why. We don't know why. It seems to be a misunderstanding. And now she's in the hospital. A surgeon wants to cut out a brain metastasis. She has breast cancer. She's a young, beautiful woman. They're going to open up her head and cut out a brain metastasis just because she didn't show up for radiosurgery in June. So it tells you something about the power. We treated some of the tumors. They're all in remission. The ones we didn't treat, we didn't have the chance to treat, have grown, and you'd expect that. And sadly, she got hooked up in a hospital, and she's going to have her head opened up just because she did not show up for her appointment. So it's kind of a lesson and a warning sign. To me, it'd be a lot better to sit on a table for 15 minutes and have my brain tumor treated than have my head opened up. She said, "I'm so sorry. I should have come." Yeah, you should have come. And I didn't even have a chance to see her now. They didn't send her. Once the surgeon had his hands on her, I think that, that was it. So it's a lesson for everybody. Come for your treatment. The tumor is treated, or in remission. The tumor is untreated, grew. Please get your treatment. Let's prevent unnecessary surgery and procedures. I like non-invasive treatment. Now, again, the patient is the president of the United States of their body and can have anything they want. So she gets to choose. I think next time, however, she would choose radiosurgery over open surgery. She's now had them both, and we'll talk about her observations about what the difference is between having your head opened up versus laying on a table, a beam moving around like a flashlight. You get up and go for pastrami. And we have another patient I want to talk about, a 63-year-old man with lung cancer who's treated elsewhere for lung cancer, and he came to us not knowing what's going on with his lung cancer. His last PET scan was a year before. He's lost 20 pounds. He has lung cancer. He likes to know what's my situation. And I think it's a very good question. What's my situation? If you have cancer, you want to know if you're in remission, not remission, where the cancer is, how it is it bigger, smaller, the same? These are all critical questions, and everyone with cancer wants to know these issues. So this man came to us. Again, we staged him up, which may sound boring to you, but we staged him up. It took an hour. We found out where the cancer is. We told him there's one spot in the lung and nothing else. And he chose to have radiosurgery for that spot in the lung. Again, it's treatment, just pinpoint, 15 minutes. You come in, get a treatment, and go to work or do whatever you want. So he's chose to do that, and we are working him up for that. That seems to be the only active site of disease in his body. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center in the heart of New York City at 38th and Broadway, 1384 Broadway. If you call us during the work week, Monday through Friday, we'll send you out a booklet. We have a new booklet, totally new, about prostate cancer and DVD, and we also have new booklets on brain tumors and on cancers of the body. So you're welcome to call us. Our office number, Monday through Friday, is 212-CHOICES. Why is it choices? Because you have choices, most likely. You just have to hear about them. Some people haven't heard about their choices for cancer treatment. 212-CHOICES, which is 212-246-4237. 212-246-4237. Call us during the work week if you'd like the booklet and DVD. If you have a medical question, you can call anytime, day or night. It's actually our cancer treatment line, 212-CHOICES. If you're concerned about your cancer or concerned about medical issues, give us a call at 212-CHOICES, and we'll be happy to answer your questions. Again, we're going to hear just from a moment from our sponsor, and then we'll be right back to talk more about news articles and patients and answer your questions.